Welcome back. Now, early orthodontic treatment, which may involve the use of braces, can be a significant decision for parents. It is important to consider the various pros and cons associated with this treatment option. The primary benefits include the ability to address potential issues before they worsen, create sufficient space for adult teeth to emerge correctly, and minimize the complexity of future treatment. Now, in comparison to treating older individuals, orthodontic intervention during childhood is generally less invasive. However, it is crucial to note that young children may experience frustration during orthodontic treatment and may require closer supervision when it comes to maintaining oral hygiene. Additionally, there is a risk of patient burnout and potential challenges with compliance. Joining us for this discussion via Zoom from the coast is dentist Dr. Rejoice Gauses. Doctor, good evening and thank you so much for joining us here on the Daily Roundup.
Good evening, Nina and valued viewers.
Doctor, talk to us about the type of orthodontic treatment you recommend for children and why.
Okay, Nina, I think it's important to discuss three concepts or categories for orthodontic treatment. These are namely preventative orthodontics, interceptive orthodontics, and corrective orthodontics. So with the first category of preventative orthodontics, this has to do with the monitoring of the jaw development as well as how the teeth are erupting or coming into the mouth. So we as dentists or oral healthcare practitioners will try to prevent a problem from happening down the line. So for example, if we notice a pediatric patient of about 3 or 4 years old has a habit of sucking their thumbs, we might suggest a habit breaker, which is an appliance, a metal device that you put into the mouth to break or stop the habit. Then with interceptive orthodontics, we might notice a mild problem in the patient already and we want to prevent it from getting worse. So say for example, you notice your child or your child has baby teeth, but they're very tightly packed together. There are no spaces between them. Or they might have some slight crowding in their anterior or front teeth in the upper or lower jaw. We might suggest for serial extractions to be done, which is just the removal of baby teeth in a certain sequence to allow for the permanent teeth to come out in a favorable position. So that might be as soon as 6 years of age or so. And then with corrective orthodontics, that's when there's a severe and definitive problem, and that's what most people know as braces. But braces is just one form of treatment. We might also suggest a myofunctional appliance, like a Herbst or head, or even the braces themselves, or a combination of the two treatments. So that can be around 12 years of age or so.
How do you determine the right age of a child to begin orthodontic treatment?
All right, so this is determined by a dental professional, whether it be an oral hygienist, a dentist, or an orthodontist, the specialists themselves. And we base it on certain skeletal or how their bones are developing as well as their dental age, not necessarily their chronological age, which is their age in years. So I cannot give you a specific answer of what year or age is the right time to start orthodontic treatment, because that varies from a case-to-case basis, as we are all unique and we're individuals. But generally it's around 10 to 12 years of age that we usually typically start orthodontic treatment. But it also is dependent on the categories that I explained previously. So my suggestion would be that you take your children for their biannual checkups so that we can advise you accordingly.
Dr. Gauses, what are some of the challenges associated with treating young children?
Okay, so from our standpoint as dental professionals, we need to make sure that since the child is still growing, that their treatment allows for a rest phase. So even though they're not fully grown yet, we might allow for a period where we remove the appliances or the braces until they're done growing in order to finalize and finish off the minor adjustments that need to be made. There also might be behavioral issues where we are dealing with young patients and they're not always able to sit still for 30 minutes to an hour and not fully comprehend why we are working in their mouth. So they might not be able to sit well in the chair. Another problem, as you've mentioned also, is patient fatigue. Because of the treatment times being sometimes long, patients grow weary and frustrated with the process of having these appliances or braces in their mouth. Compliance is also an issue because they don't fully understand why they need to wear the headgear and the braces, so they won't typically wear the appliances as they should or brush their teeth as they should.
Yeah.
And for the parents, cost and duration of treatment is also an issue. They don't fully understand why this treatment is taking so long, why they need to go every month for their checkups. That is a problem and a challenge.
Just lastly, Doctor, what are the key benefits of early orthodontic treatment?
So this, thank you for the question, Nina. This simplifies the treatment for your permanent dentition or your permanent teeth down the line. It also offers better stability in your results. When we're using the patient's growth, it also aids our treatment to prevent further severe problems down the line, and also preventing orthognathic surgery, which is jaw surgery, in order for the jaws to fit correctly on top of one another. So we can also prevent that from happening by starting at an earlier age. We also improve on aesthetics, or how the child appears. And we avoid psychosocial problems. Children sometimes get teased for having skewed teeth in their mouth. So we prevent those psychosocial problems from occurring.
Well, Doctor, we appreciate your educational conversation this evening. Thank you so much for your time and joining us here on the Daily Roundup.
Thank you for having me. Have a good evening.
Well, after that, we're going to take a little break. When we come back, our conversations here on the Daily Roundup with Nina.